Welcome, everyone. My name is Chris Trudgeon, and I'm the Director of Education and Case Management for Foundation Health Partner. I really appreciate you being here for this training session, and I want to connect a couple dots for you. So the information that you're going to be hearing today is directly linked with two different WIGs that we have going on in our organization. One WIG is with education, and the other one is through the quality department. Both of these WIGs are really focusing on how we can effectively train our employees on cultural competencies, especially around the Alaskan Native population. We have found that the results of our patient experience scores are significantly lower when it comes to our Alaskan Native population. So we have partnered with Quality to focus on the National Patient Safety Goal number 16 around equality and to increase those scores, but also to increase the education and awareness of how to better communicate with our Alaskan Natives and how to better care for them. So the session that you're going to hear today really links with that. And we're going to be offering sessions throughout the entire year. So be looking forward to other opportunities to come for more training on this particular topic. So again, thank you for being here, and we look forward to hearing any kind of feedback. You could always email me or Sarah Viola at the Quality Department. Thank you.
Good morning, everybody. The other day I was thinking about a presentation that I did several years ago. I've been asked to speak on cultural issues a number of times, whether at the university, even out of state and in Southeast at different conferences. But this one time I was doing a presentation to public safety officials here in Fairbanks. And afterwards, this woman came up to me and I was thinking, it's interesting because she had tears in her eyes and wanted to let me know that she was Indigenous from Canada, and that she had married someone that was a non-native person. And she said, after your talk, now I realize why my husband wasn't picking up all my cues. He didn't understand me because I'm using traditional forms of communication and he just wasn't picking it up. It sort of drives home the point that cultural issues and understanding how to best communicate really are important universally, whether it's in your own home setting or if it's actually in the workplace. And I really appreciate the hospitals and Foundation Health Partners' commitment to ameliorating our communication with all people groups, wherever people are from. I'll be speaking about cultural issues, and I should introduce myself. Don Thibedeau Sausa, Ina Ruth Mayo, Rampart Bitzar Hutani, Ita Richard Thibedeau, Wisconsin Gusakutani, just means that my name is Don Thibedeau, that my mother was Ruth Mayo from the village of Rampart with the Caribou tribe, and that my dad was a white man from Wisconsin. So in our traditional way of introducing people would say who your relatives are, is how you connect with other people. Currently at Denali Center, I have two relatives. If we look at, going through our family trees, at one time I had 5 relatives that were living there. So there is a connection of importance of knowing who your people are. But when I look at cultural issues, I like to emphasize to everybody has a culture. If you go to the store, it's St. Patrick's Day. We're all celebrating whatever the theme is going to be. Easter is approaching and many people are getting ready for Easter. So culture is just embedded in every one of us as we grow up. What we learn from our parents, what we learn from our society around us, we all develop a culture. My goal today is to present certain aspects of Alaska Native cultures that may help you in your interactions with patients that come, with coworkers, whatever populations that you're working with. Hopefully this will be beneficial to you. So with that being said, I do want to give appreciation. Many of the stories I'll be telling today come from our elders. And so this is sort of dedicated to the chiefs that were before us and the chiefs that are among us now. And in many ways, many of the people we're working with are our respected leaders. Denali Center is an Eden facility. And one thing I loved about the Eden approach is it calls all of our residents elders. So that could mean your 21-year-old resident is an elder, because an elder is someone that we learn from. Again, so important that we understand culture is worldwide. And for many of you, you may know that I've worked at Denali Center for 35 years. This year is my 35th year. And so early on, I learned how important it is to understand people from different backgrounds. Years ago, we had a lady that was admitted from Peru. She had lived in Fairbanks for 21 years, but with a daughter and a son-in-law and grandchildren, never had to speak English. So she really only spoke Spanish after being in Fairbanks so many years. Right away, we all learned what café con leche bien caliente meant. It's hot coffee with milk in it. Because that was important to her daily life, is to have that in her. And it wasn't like we just pour it in there and mix it and then give it to her. It had to be hot. Though she was 90 something, it had to be hot. But understanding again that how can we're not going to possibly learn all the languages and everything about every culture, but can we be sensitive to some that we do understand? I like to show this map of Alaska because it reminds us that all over through Alaska, there are many different indigenous groups. I also like to show it because even among groups that are close together, like Fort Yukon is Gwich'in, and Stevens Village is Denali. They're close together on the Yukon River. But if the elders are speaking their own language, the two Athabascan languages are different enough that they would not understand one another. So that just kind of reminds us that these groups were separate among themselves, even though they're coexisting nearby. Han Gwich'in language, there were about 13 speakers. I know one had actually two had passed, so there may be just 11 speakers left of the Han language. But they're all trilingual, so that they understand Gwich'in, and they understand English. They understand their own language, Han Gwich'in. But it's different enough that the Gwich'in would not understand them if they spoke in their own language. I just wanted to show that out so that even though it's all Alaska Native, the language backgrounds may be different enough, and some of the cultural issues are different enough. For years, we've enjoyed serving culture nights. So last night at Denali, we had some moose soup. We had some salmon sandwiches. Because it is President's Day yesterday, I thought, well, in George Washington, he's famous for the cherry tree, right? So we did have some cherry chocolate cake. But other than that, we try to incorporate foods that people will enjoy. But times change over the years, and some of the parts of Alaska may not be used to certain types of the food. So like when I serve, my cousins will send me different, like muktuk, they'll serve me or send me different things that are traditional from up north, and I'll share that. But not everyone is used to eating the different preparations of the muktuk. And then with moose head soup, our residents really enjoy that. It has such a delicious flavor. But there are some younger ones that aren't used to the moose head soup. And so just trying to go with the times as well, but understanding how important it is. This is a map of, and I wanted to show this just to kind of point out that pre-contact times, indigenous tribes lived all throughout the United States. And then the next slide just reminds us that many of those tribes then were sent and confined to small areas, small reservation areas. In Alaska, and you can go ahead and keep going. Pre-contact time, there were actually large villages, large settlements that no longer existed after times of contact when disease came and there were much loss of life. And you can, some of this I have for you to read and just kind of take in. I'm not going to read them for you. with the contact, the disease came. You remember when COVID came and we were learning how to start to separate ourselves and isolate ourselves and try not to have a mass infection. And so there was a huge effort that went out there. And Tanana Chiefs made a great effort to reach all of the villages in our region to make sure everybody had the proper vaccinations, everybody had the proper care that they needed. They learned a valuable lesson from elders that reminded them that in the early days when the diseases came, it decimated huge populations of people. Chief David Salmon is one that had told me a story of when he was young and that illness had come through and people were getting sick, that his dad took him off into the woods and they lived out in the woods for like 5 years without being with anyone else so that they would themselves would not become infected, and kind of reminded us the importance of social distancing and that the concept that we use nowadays to help prevent disease spread. But also, unfortunately, through the history of Alaska, different groups were brought in to provide education through the Bureau of Indian Affairs work. And Fred John is a gentleman from Mentasta. His wife, you may, if you know recent Alaska history, was Katie John, who was very instrumental during Governor Knoll's administration for subsistence fishery rights. But this is kind of his impression of when he had gone to school. So many of our elders have told stories of a loss of language, or even told not to sing their songs, told not to dance, definitely told not to speak their language. We'd go to the boarding schools and they would hear, go to bed every night hearing people just crying and crying because of the abuse that they took. And men and women both have told me about the sexual abuse that happened, or just horrible things, growing up to receive your education. There definitely are many that have done well academically through their experiences in boarding school, but there's also many that have been traumatized. I think as Foundation Health Partners, we're all aware of the importance of, trauma-informed care, and realizing that early trauma in people's lives do lead to multiple health concerns, whether it's mental or physical, behavioral health concerns that do challenge people. Judge Steinkruger, who's Dr. Laura Brenner's mom, was involved after her retirement, I would say so-called retirement, because I think she was busy doing this, and gave herself completely to finding the story of the missing Alaskans. And this is where, through our history, in the last century, in fact, that a number of people from Alaska were taken to Morningside Hospital in Oregon. And so, the orders that were written on the paperwork were, that these were criminally insane people. It might mean that someone had Down syndrome. We had a gentleman that stayed with us who had polio, and so he was sent to Morningside Hospital. A number of people, postpartum depression, it could be, women that were going through a hard time, sent off to the hospital. So I was talking to a family member of this one gentleman that went, and so I asked her about, her uncle had told me stories of going to the hospital, that, they were at the house in their village, and the troopers had come and had, they knocked on the door, and then he and his brother were taken. They were put on, the train eventually to go to Valdez, and on the boat down to the States. He made it back, but his brother did not make it back. So I was asking her about her other uncle, the brother that never made it back, and she really didn't know. She said, I'm going to have to ask other elders in the family to see if anyone knew, because he was just taken away and never really was a part of the family all those years. So many share that history of what it was like just to be taken away. I share that because it all goes into the idea of trust and confidence. So as a healthcare system, we want to we have the excellence, we have the skills, we have the machinery, we have the infrastructure to provide really good care to people, but can we present it with trust? And people have confidence in us if, in fact, so much of your history says, I cannot trust these people. There have been so many stories, whether you read it through our local news miner or you hear about it other ways, of injustices, of treatment of people that are sort of not believed or not taken. An example this last week is someone had reported that their sister was missing, and the response was, well, maybe that's a choice, that she doesn't want you to know where she is or doesn't want to be found, versus taking to heart that here's another missing person that is gone, and time is going by without anyone trying to help solve a problem. And I'll just leave this for you to look at. One of the gentlemen that was on that last picture frame, Yvonne Peter, is a leader at the university and does science and studies for indigenous populations, but also just to make awareness for everyone. Again, advocating that people would be respected, that we take seriously losses and missing of people. You can go ahead and move that. Thank you. So with that being said, I want to share a few things. There was studies that was done and published by Levan Hendricks, and it shows maybe some different ways that people would communicate and view each other, where maybe I'm coming from this perspective and you're coming from another perspective, and so how could we understand one another? And thank you for sitting up front. So to survive off the land really takes a lot of cooperation. And this is a picture of Nalakatuk. So if you think about bringing a whale in, it's not just that captain and his crew that got that whale and carried that in by himself. It takes a lot of people to pull that whale into the shore. So there's a lot of cooperative effort. And with the Nalakatuk, it takes quite a few people to toss that walrus hide up in the air so that you can send someone up. It's really a part of the celebration. But one of the ideas behind it is that, we're not so successful getting the whale, it's that the whale gives itself to us. And so when they throw someone in the air, it lets that huge whale that we can all see the insignificant person that we are, and then make the decision to give itself to us. So whether it's the whale or whether it's the big moose, the feeling for many hunters is that we were lucky it came and gave itself to us. So it takes a lot of, again, that group cooperation and that harmony for things to be successful, to work together. When I say this, like one way that it maybe look differently, so many, in our culture, in the United States, it's important to go to school, to get an education, maybe to get your degree, to make these milestone achievements. And for an indigenous family, the consideration, those are all still very important things. But now what are you going to do for your people with that? This is Chief Andrew Isaac, was one of the most very eloquent in speaking, very knowledgeable about history. He was involved through the time of the Alaska Native settlements and a big part of Alaska Native history. He became chief of the Athabascan groups for all of the interior of Alaska from that map that I showed you earlier. Even as he became older, even as his voice became more frail, I remember going to hear him speak, and just the hundreds of people, like 500 people that would be at this meeting. And his voice became quieter as he got older, and just hearing him speak, that you would hear no other sounds in the room. It'd be so quiet, everyone was just so attentive. So much respect that was given, even in that very humble person. And not speaking of himself highly or bragging or drawing attention to himself. Downriver, I told you about my mom being from Rampart, so that's Denali people. So in Denali language, there's a word called hutlani. That's where you don't say some things. It would be hutlani to brag, to draw attention to yourself. So that's some kind of humility. Some may look at it as stoicism, like, okay, they never complain, or they won't tell us about their pain, or they won't share their own information because it was sort of against the culture just to speak too much about yourself. So non-interference, having, for some people that look at indigenous groups, like they're not, correcting their children like they should, or they're not doing, they're not policing what's going on as much, versus a thought that, I'm not supposed to dictate what these other people are doing. And it's hard to speak against someone else. That's why in some court cases and things like that, it's hard to say something negative about someone else, because it goes against your original Hutlani thing of I wouldn't speak that way. Chief Peter John, this is so much of communication is really nonverbal, and our presence with one another. Even interestingly enough, I was taking a group of residents to the Naughty Pine Shop so that we can go have some ice cream. And so we're driving down, I've got the bus, and I've got several residents in there. My coworker is a Nipyak Eskimo, and so she was hearing a gentleman, one of the residents said something to her, and he used the word itkilik in there. And so I understood the itkilik part, but I didn't know the other part. And she said, he says that there's an Athabascan person in the van. And it turned out that even though they weren't saying words, different, sort of like guttural expressions that are different between Inupiaq and Itkilik, or Athabascan way. So even though they weren't saying words, they understood that they were in the presence of someone else was there. I just share that to say, even though we feel like we're not saying words, people are reading your presence and are reading how genuine you are. People understand and are perceiving who you are and what you're bringing to the conversation. I wanted to share this one because sometimes, especially, how many are nurses here? So you know how you go and you want to find out who's the next of kin of this person, who's the decision maker, who's the power attorney, those types of things. Especially if an important decision needs to be made, and especially if that patient of yours is no longer able to communicate for themselves. Now, who is going to? And so nurses and doctors are looking for that person. But sometimes in the cultural way, it may not just be that very next of kin person, the biological daughter. It may not be that person. It could be someone else. I remember we had this elder that was with us, and when he was not doing well, his wife told me, and the children told me, his brother has to make these decisions. And this man was 99 at this time, and I was thinking, well, I kind of know the family, I just don't know that brother. I don't think I know that brother. And then they went on to say, well, he grew up on the same tash, so that caribou hide, they grew up together on that hide. And so he's that one that makes these important decisions. So just being aware that sometimes it's not just an individual, there's a group thing that's going. I did have, if I may share another story of a lady that had told me, when I asked her the question about CPR, so you're familiar with that discussion, and she says, I've been through 2 strokes. I've made it through the first, I've made it through the second, I'll make it through another one. They need to do everything for me they can. So, okay. What I didn't know is the doctor had been in there before me. And he had just been to the nurse's station and wrote the orders DNR for do not resuscitate. So I told the nurse this, and you said you're a nurse too? So now, imagine now, I'm asking you to call the doctor to reverse his order. Not a very fun thing, but that's what she did because that's what the resident was saying. And so part of my job, is I communicate with the resident, but I also communicate with their family. And so I was telling the family about this, and they said, oh, Don, maybe she didn't understand. We'll ask her in our language. So, okay. And even though she was quite clear with me, they're going to ask her in their language. So they came back and says, oh, Mom, she does not want anything done. She wants to just, it's her time. Let her go. I said, oh, okay. Well, I just didn't take their word. I went back to the mom. So I asked her, and she said, my kid said it's okay. So when this happens, I'll just go. And she was very much at peace with this. There was a group consensus, a group decision, and she was all right with that.
So she was putting up a brave face then.
Well, yeah, she didn't look disappointed or upset or distressed, but very much it's okay. The group had made a decision, and that's my decision too. So that doctor had a few calls that day. Those familiar with the potlatch tradition, you may put on a potlatch if it's for your first moose kill. It may be for an achievement that you had. It could be that you're very sick. You're very sick maybe and going to die, and your family will put a potlatch to honor you even before you die. It could be a memorial potlatch that you do after someone passes away. So there may be a number of reasons that a potlatch would be given. And there's a lot of preparation that goes for that potlatch. So giving away versus the idea of I have to save. So one example of this, I often will do this similar presentation to this for end-of-life care for hospice, and would be very fortunate to be joined by Judith Snow, who was a retired nurse from Chief Andrew Isaac Health Center. Judith was from the village of McGrath, and she would tell the story of how someone would prepare way ahead of time and have all this wood for winter, and maybe someone else didn't get as much done, and winter was brutal, and they ran out of fuel. So the expectation being, you have, and so you would share without any other thinking about it. Of course, you would share with someone else. So a little bit different way of thinking sometimes. Now, of course, this is a picture of putting up some delicious salmon strips and making enough to last you, because so there's a lot of work that goes on preparing ahead of time. But with that being said, because of Hutlani, because of I have respect for time, I don't have control over the future, so I wouldn't just say things about the future. Like my plans for tomorrow, my plans for next week, what I'm doing here, what I'm doing there, because maybe I won't be alive for that. So lots of work, as I mentioned, and mainly I show this picture just because this is Matthew, who is from the village of Eagle. When I grew up, Fairbanks had a flood in 1967, so our family all went to Eagle. And so I remember the village as it was and going to school not far from there for a year. And during that time, having the schoolmates that lived in this area. A few years back, when the Yukon River was beginning to break up, it literally broke up and it jammed near Eagle, and the ice just went up and just obliterated this whole village. So all those houses no longer exist. It's basically just brush that's growing up in that area now. So I kind of like to show that, but a lot of work goes into always preparing for the next season. So every season throughout the time, like we're getting ready for rat season. So it's the time that people would be getting muskrat. And then would have fish camp. And then, all the time when you're picking berries, and then you have your hunting times, and then you'd have your trapping time. So every part of the year has a different seasonal importance that you're putting into it. So there's knowledge of the times of the year, but you're kind of living more in that present time. And that's why I show this picture more of following the seasons. I mentioned about the rat camp. One day I had a roaster filled with muskrat, and I was going to be sharing it with the elders. And I was just getting ready to go to this one room, and I heard these two ladies praying in that room. I thought, I don't want to disturb their prayer. And they said, "In Jesus' name, amen." So I knocked on the door, and I said, "I just wanting to see if anybody wants some muskrat." And they said, "Hallelujah, he heard our prayer already." They were just asking the Lord to have some of that fresh muskrat. I put this one in there because Chief Peter John is also known for talking about having that birthright to the land, about the importance of the land and how much that land means to us. So many times I've had elders want to make sure they're able to go back to where they're from. And sometimes where they're from is no longer a village. The village had ceased to exist some years before. But still that interest of, that's where I'm from, I need to go back to that place. One of the most dramatic events that we did have is we had a gentleman in his 80s that was very near death. So clinically he was getting quite close. And his wife says, "Well, we're going back to our land," which was not a village. It was a cabin on a lake way up north. She had arranged for a helicopter to take them and drop them off. And I'm thinking, this is amazing how she's going to pull this off, but she did. Took, I think, a daughter with her. They landed there. And so when she got back, I asked her, "Well, how did that all go?" And she said, "We landed and we got him into the cabin. It wasn't long before we heard four-wheelers in the woods, and people were coming with wood, with moose meat, with fish, and different things to keep us going until my husband would pass away." So just really important to have that connection to where you're from. And that's why sometimes it's difficult to, the insecurity of leaving your home and getting the care elsewhere. When I mentioned about the history of Alaska and the non-native contact that came in, and the education and illness, many other things that also came introduction of lots of religious beliefs. So up north, many people were Presbyterian. Along the Yukon River, Catholicism, Episcopalianism, Russian Orthodox, just all throughout Alaska, different spots where strong traditional religious practices came into being. I think later on there's a slide about traditional Athabascan cultures and values. And with that, so many of the values that had long been taught to people kind of aligned with teachings in Christ. And so Jesus talked about loving, about giving, about sharing. So many things, respect, some of these are universal, principles that people have. And so really it was kind of easy to accept then when churches came in to adopt those beliefs. And this is Chief David Salmon, who was the first Alaska Native ordained Episcopalian priest. I think the first American Indian ordained Episcopal priest, if I'm not mistaken. David Salmon, besides being Episcopal, was also somewhat evangelical. He believed in speaking in tongues and, being more engaging with his religious fervor with his people. But as a chief, he was very strong in cultural background as well as spiritual. I share that because one time we had a care conference for an elder that was kind of approaching, the end of her life. And I remember her son saying, "Dawn, you have to think of my mom in three ways." you see the person that has her health problems and may not be doing well, and this is what's going on with her life physically. But she's also strong cultural, bearer. In fact, at that conference, there were 2 ladies that came to the conference that were from the village to honor her in a cultural way, that she was a respected elder from that village, and so we would do things right culturally for her. And then he said, and my mom, strong believer in the Lord. There was a priest that was there with us that she had strong spiritual beliefs, and this body is not the only body that she has. She has an eternal life. Wanting us to realize, okay, it's not just the patient that we see in front of us, but really there's a whole lot more to that person, and how could we honor each part of that? I will share a mistake that I made. We had a resident that lived with us, and she had COPD. So with that, there was some anxiety, some difficulty breathing at times. And often I would see her, she's sitting in my bed, so I have to go to this other bed. I would see her at the edge of her bed trying to get her breath, and mostly that's when I saw her. One day, I'm passing by her room, and she is laying down flat on her bed. And I'm thinking, Agnes is resting finally. I was so happy for her. She looked relaxed. She was just resting. She seemed to be breathing with no problem. So I just let her lie. Well, it happened to be the time that we were having Episcopal church in our activities room. She woke up and she said, Dawn, why did you do that to me? Why did you let me sleep? I don't have that many more masses to go to, and you didn't let me go. And, I wanted to think, well, there's other people passing by, But she knew that I should have known her choice is to be in church, and it's not my choice to make for her. And so one thing I do tell our staff is it's important to know what are people's religious backgrounds, and can we honor that by, if that's important to them, if we have a rosary or if we have a mass or we have whatever, can we assist them to get there and not be the ones that decide if they're going or not? I mentioned about that consensus about the extended family. I like to show this picture because Grandma Alice and Grandma Ann are from villages across the river from each other. One is from an Athabascan village of Alakakit. The other one is from an Inupiaq village of Alatna. So the villages are, like I say, you could see one from the other. They're that close. And there's some intermarrying that did happen, definitely, and still is happening among the villages, even though they're from the different backgrounds. So when I think of extended family, I did mention about my dad being from Wisconsin and marrying my mom, who is Athabascan. His brother was a pilot, and he kept going further north and married a lady from the Utkatvik area. She was from Wainwright, but lived in Barrow also. And so my first cousins are Inupiaq from that side. When we address them, like all the kids from the next generation below me would call our first cousins like aunt, or uncle. They wouldn't think of them as a cousin. And then all their children would not think of me as cousin. I would be Uncle Don to those kids. So it's sort of a little different how people look at one another and their relationship. Sometimes people say, my sister, who is really not a biological sister, but again, it could be that cousin, it could be that other near relative, but in their way of talking, it's like their sister. Yesterday, I was able to escort one of our residents down to Anchorage for a medical appointment. And so I would call him Gana. So every time I talk to him, I said Gana. In our language, Gana means cousin. It could mean friend. It could mean like brother-in-law. So it's that close person that you're working with. So Gana, if I could say that, and then because we're close friend. These are those traditional values that I was telling you about. And if I were to show you Inupiaq values, if I were to show Yupik values or Tlingit values, these are generated by elders, people from those various community areas. A lot of them would be quite similar. And I think, again, culturally speaking, everybody's culture, respect is tied in there. We should all be respectful. And even respect for the land. One way that's different is, so for example, like if I'm going to, one elder told me she had a chronic problem sometimes with cellulitis. She would pick some stinkweed and she would say, I'm not picking you for nothing, but I've got this infection. I'm going to boil this up. I'm going to make a poultice to kind of bring healing. So being respectful even for what the land brings to you. I mentioned about the moose and the moose head soup. Have you guys ever worked on 2 South? No one has. So there was a wonderful nurse from 2 South, and she said, Don, you'd be so proud of me. This family brought in some moose soup for the patient, and they were not feeling well. Their stomach was kind of upset, and they were tired, so the patient wasn't ready to eat right then. So I put it in the refrigerator, and later on they woke up and they were hungry. So I heated up that soup. I brought it to them. Before that, I picked out all the gross things, and then I gave it to them. So all those gross things were the gum meat, the cheek meat, the nose, all those delicious things that really make that moose so savory. I just share that because then later on, I had a scene, they said, Don, you'd be so proud of me. I gave Grandpa his that fish head that you cooked up, and I served him the eyeball without getting sick. So she had this person had come a long ways toward just respecting that really every part of the animal is usable. I've had people ask me for the rectum. I've had people ask me, for the intestine. Whatever part of the animal, that really has good nourishing factors to it. So that's why it's hard, when they hear about hunters that, leave the head behind or leave parts of the animal behind and just not really using the entire animal. It's like that's, in a way, that animal has given itself to us, so it's like we're disrespectful to it. So with that, I'm going to share some more communication ideas on how we can maybe think about how we communicate, how we come across to other people for best communication. When I talked about the moose, is this what you guys saw? Or in your head, were you thinking of this? I just share that because sometimes the words we use may be differently used among different people. One example is one of our residents told me about an event that happened the night before. That man, he came to my room and he took down the blanket, he pulled up my skirt and took down my panties. And I'm just remembering that the family had stressed that no male caregivers for this elder. She only wanted female caregivers. And so I'm just not sure where this conversation is leading us. So I said, that man, was he a woman? Yeah. So, okay. Was she a nurse? Yeah. And so then she went on to tell me about, she had had a stroke and she had become incontinent. And this person had to change her. And she wasn't used to having to have been changed. So sometimes being aware that a simple word like that, a gender where you're using a male pronoun, like I've had men that says, my wife, he's a really good cook, but speaking of the woman, his wife. So it's just in the language, that article, that pronoun is built into the verb. So now in English, they're having to say a word that's already built in the language. So it's a little different way. Younger generations definitely have it down for, man, male or female, or how to use the pronouns. But among our elders, sometimes it did come across differently. But it wasn't even too many years ago that I had someone come to my office and asking for my coworker, Jennifer, and said, "Is that man here?" So Jennifer doesn't look like a man, does she? No. But just that was the wording that someone might use. So just being aware that sometimes the first words that you hear, is that what you're interpreting it to be? And could it actually mean something else? Even a verb like look. I asked someone a question and they said, "I didn't look." So what that meant was my eyes really aren't what they used to be, and I don't see too well. Versus I wasn't looking and paying attention, I just don't see well. So they use the word look. I mentioned about all those different people groups, and so Elder Hannah Solomon, who lived to be 103, there is a center or a building that's named after her on Wendell Street. And Hannah shared this piece of advice to me when I was going to go visit her sister. And again, how the languages could be different enough. You almost have to find someone in that same village that's going to be able to really communicate freely with them. Obviously, we cannot learn every language and every possible thing. So the best thing we can do, though, is to be appreciative of each one, where they come from. And if you can learn a couple words here and there, it all helps. I had an elder that she asked me, why doesn't that person like me? What had happened is she had asked for some water, and the CNA did not bring it. Now, what happened likely is the CNA was rescuing someone that was falling out of their chair, and somehow the request for water dropped down on the scale of importance and kind of probably just forgot about it. But because of the respect for words, it's hard to repeat requests sometimes. You definitely have met patients that can keep asking and asking and asking, but also for many people, they've asked once, they wouldn't want to ask again. It would be difficult for them to ask for that same thing again. So I would tell them, "Oh no, she's still like you. She got busy doing something else. It's okay to ask. It's okay to hit that call light again." Eye contact. Someone brought up a really good point about, making sure that you guys have just given me great eye contact during this presentation. But if I were coming to speak to you individually, you that is, I might, as we're sharing, I'll kind of divert my eyes a little bit. So I'm having a communication with you. You're sort of studying me as I talk. And then as you're sharing something, I might look at you, and then you would sort of divert your eyes away from me as you're sharing something important. Now, for nonverbal communication, where we're using expressions and stuff like that, that's when we're really watching to see what all those expressions are and how you're positioning and everything like that. But for us, if I'm having an important conversation, I really want a respectful hearing, we would do that. A few years back, Tanna Chiefs was having an election for a new CEO, president of Tanna Chiefs. And one of the people that were running for office was a young man who's prominent person at the university. He was a chief in his village. And I remember his grandmother and the importance that she had put on education, on doing things for your people. So I went up to him to say, basically, I know how proud your grandma would be that, you're doing what you're doing. But as soon as I approached him, he went down like this to hear what I said. So he was giving respect to my words. I share that because sometimes with police and with different people that are doing interviews, you're watching them to see they're reading body language too. And so the assumption sometimes that people look away is that they're not being truthful. And so they're assigning that judgment that this person is not telling me a true story. They won't look at me directly in the eyes. but to show respect, I would not look directly. I'm going to shake your hand. So it could just be one shake like that, just a simple shake. It doesn't even have to be a hard grip. It could just be a friendly greeting that you're doing to someone else. Yes, there are those that may pump your hands, but essentially it could just be a friendly shake. Information by word of mouth is when Chief Peter John was talking about silence and about hearing what the person is saying. So word of mouth is the sharing of information. That's how you're going to be able to share your information, by telling your stories. I mentioned earlier about your personal information, though, is hard to share. I did have a physical therapist come to me and say, Don, I'm going to have to discharge this patient. She is not cooperative. She's combative, and I'm not going to put up with that. Oh, sorry, physical therapy is here. Anyway, I said, oh, she'll work with you. Go have a cup of tea with her. Her husband's name is Victor. Her daughter's name is Victoria. Her son's name is Victor. Go and talk about the Victors. So that's what I told the therapist. I kind of made that up a little bit, so I hurried over and I said, that woman, she was trying to work with you. And she said, that dirty woman, she touched my private. I said, oh, what happened? She says, she took my leg, like this. I said, oh, doctor was concerned because you've not been walking. And he wants you to practice and get stronger so you can walk, and he wants her to help you do that. Oh, okay. And so the therapist went and she had tea with her, talked about all the Victors. She came back the next week. She said, Don, you wouldn't believe it. She's doing everything I'm asking her to do. She's making progress with her therapy. It probably was the tea, engaging with someone enough that it's not just the patient with a disability, but it's the person that's behind that. And being aware too that that personal part, you have to sort of get the trust to get into that personal part and what's important to that person. Sometimes we're so good at just asking questions like, how are you today? I don't know how often you maybe even heard it this morning, and fine, how are you? Just a real quick response. And it's a kind of a polite thing to do in culture, just to have a greeting. This is what Grandma Alice told me. You already can see that I'm up. You already basically, just by looking at me. But Grandma Alice, before she had passed, I went to her and I thanked her for teaching me and letting me learn from her. And she said, "What did I teach you?" And I said, "Well, you taught me how to listen and to hear what you're saying." Alice had come to us after basically a stroke that had affected one side of the body. She had a pin in her leg on the other side, so basically it immobilized her. And so she came to stay with us on Aspen Way. For those familiar with Denali Center, it's like our short-term neighborhood where people can recover and receive the therapy so they could go home. It was determined, though, that unfortunately she was going to need to stay longer with us. And so we invited her to stay we had a bed open in our long-term care neighborhood of Tamarack Trail. Coincidentally, we had a nurse that was transitioning from Aspen to work on Tamarack. And so I was visiting with Alice, and we were talking, and she told me about different physical things that were going on with her, about pain that she had, about how the stroke had affected her and things like that. So having heard that she had some pain, I went to the nurse and began to relay this to her. She said, "Dawn, how do you know this?" And so I was talking to Alice, and this is what she told me. She said, "Alice can talk? I've been her nurse for 2 weeks. I thought the stroke took that from her." So didn't know that Alice could talk. Well, Alice was a traditional speaker, which means that I wouldn't just answer right away. So when you come to my room, I need to respectfully give your words some thought before I would answer your question. And so we educated everyone about cultural communication along the Kaikuk River and how we're going to do this. And so a few weeks later, we had our care conference. And so I asked Alice, how are things going? She said, you know, I had a stroke. And so I may have some trouble with speaking. I put on that call light. That nurse come. I looked the other way. I look back. I see that curtain flapping. So it reminded us we weren't giving her the time to express what was important to her, and we're entering into that respectful mode of communication. So with that, sometimes it's what's called a pause in I guess, anthropologically speaking, in communication. A pause is where you would not answer just right away. Or the first thing you say is the superficial information. I had a resident that was 98 years old and the champion bowler at Denali Center. Every time she threw that ball, she would hit every pin. They would just go flying. Because she was humble and would not brag on herself, she would just go hee hee hee, and laugh about her success. Well, I was gone for vacation and came back, and so I had her in the office with me, asked her how she was doing, and she said that she's doing all right. I was so glad because she actually had a tortuous carotid problem, that was going on, but now she was able to, she was breathing, she looked good. And then I saw her look down like this. I thought, okay, she's gonna tell me something else here. So I waited. And she said, that man, he's bothering me. And she was talking about a gentleman in his 80s that had dementia that mistook her for his wife. And she did not welcome his advances toward her. Basically wanted me to do something about it. I thought, what if I missed this pause? Because sometimes the first answer that comes is not the most serious concern that someone might have. How we get around that as staff, everyone's on a time crunch, or there's another place you got to be, or another task you have to do. You could say, is there anything else that you want to let me know? They might say, in the day, our elders would say, hutla. Hutla means wait. Or they just may say, wait. And then they're going to tell you something else. So you can use that cue of someone saying, wait. So that's where listening becomes key, that we're actually taking the time. I'm running out of time, so I won't do that now. Normally in a presentation, I'd let it go for 20 seconds. That's a lot of downtime for us, and we're thinking. but in fact, after the 20 seconds maybe is when someone's ready to enter. So when I would go to visit, when I showed you Grandma Alice, I'd go to her room and would say hello, the initial greeting, but then I would just sit there. Basically, we're waiting the time out, and then we can start having a substantive conversation and we can share information. So the lady that you saw in the previous picture and the one in the second lady in the second picture is Elsie Titus from the village of Minto, who also taught me lots of things. But I borrowed this term from Hawaii, the talk story that people have, because so often, you've heard me today share quite a few stories. Sometimes a question that you may ask is going to be answered with a story. It may be a yes or no question. So I heard that she was in town with her daughter, Jenny. They were staying at the Golden Nugget Motel. So I went and knocked on the door, and I had a yes or no question. She said, in 1955, she went through the history of aviation in their village. Now, through all that story, I got my answer. But just being aware that sometimes, you ask a question and the answer may seem unrelated to what you just asked. And you can say, well, this person's confused, they're not oriented to time. But in fact, they're sharing the story that's going to help you find the answer. In my family, I told you my dad was from Wisconsin, so I'm just thinking we all just speak and communicate just like everybody else does. Well, I have people I'm number 11 in the family, so I've got brothers and sisters that have the different styles of communication. So my one brother, definitely a storyteller person, he would call and I'd look, do I have 30 minutes? Because he'll go one story to another and finally get there. I shared with you about nonverbal communication. So sometimes an answer comes with just an expression. We had a gentleman that was staying with us that would be somewhat combative with cares. And we called this sister in and said, please help us to understand what we're doing wrong, because obviously we don't want staff to be hurt. So she would say, I come to bring some trout soup from my brother, and he gives me this non-accepting look and a frown, and I know this is not the time that he's welcoming visits. And then I'd come again and I'd bring some dried fish, and he's giving me a smile and an accepting expression. What she was telling us in that story, what his brother is communicating yes or no with me. And so we were going in, and maybe he was incontinent and needed to be changed. He's giving us the nonverbal no's. Now imagine you're telling me no, and I proceed to pull your pants down and change you anyway. You would be very upset. Well, he was non-verbally telling us the no's. We weren't picking it up. So we learned, okay, keep going back, and when he gives us the yes expression, that's when we're allowed to change him. He didn't go incontinent like for days on end. He definitely within the shift, he was changed and cleaned and all that kind of stuff. But we were watching his answers, his cues to us. I brought him to see a doctor, and the doctor was asking him several questions in his interview, and he was giving all nonverbals. So I would just say out loud, he says, somewhat. He says, oh, the pain is so-so. He says, well, he doesn't remember that he had breakfast this morning. By the way, he's on tube feeding. And then we just went down the whole series as he non-verbally, I just said what he said. I saw the doctor writing patient alert but non-responsive. Fortunately, that doctor went stateside. But just the idea that people do communicate non-verbally. He won the door prize at the corporation meeting, so I asked, what you want to do with that money? Go see mom. So, okay, so I took him to go see his mother in this village. They're from the village of Kivalina. And wheeling him down to, the hard packed, shore, we passed by a walrus, and next thing we see a bunch of kids, and I asked the kids a question, and all of them raised their eyebrows in answer. No one said the word yes. And I asked them some more questions, and all the answers came back non-verbally. Just to kind of remind us that even though those kids obviously can speak and enunciate initial reaction just from their community, it might be some nonverbals. And I share this picture of the island of, big island of Hawaii on Spencer Beach Park. My dad retired to Hawaii. And so I told you I'm number 11, so I would need to go make sure he's okay every January. And so the third Saturday of January was the Alaska Day picnic. And everyone's got, their name tags on, saying, where they're from. And this one lady had her name tag from the village of Nome. And I'm talking to her, and I said, oh, here, I thought that you were from Wales. Wales is like 40 miles west of Nome. And she said, yes, I'm from Wales, but I haven't been home for 28 years. I didn't think anyone would know, though I just put Nome. But because of how she spoke, I said, it just sounded like, the way you use words that maybe you're from Wales, Alaska. So even though people are away from it for many years, sometimes some of those just ways of speaking will stay with us, through time. Sometimes a question isn't like an outright question. It may be an indirect request. It may be a hint. So like Grandma Margaret, for example, she would say, I have no candy, meaning, can you go get me a Milky Way bar? So someone may say, you know, I have no water means, if you don't mind, please go get me some water. And then I mentioned about disapproval. I'll just tell you about that sometimes people withdraw from something because of maybe we've offended someone in some way. I speak to pharmacy groups to say, you know, sometimes we're being so careful with our instructions about not misusing medication or not losing medication because of potential for, you know, theft or abuse or all kinds of things that could happen with especially narcotic medication. But sometimes that feeling like it's as if I'm being accused of doing that. And so instead of advocating for yourself, you would just sort of somewhat withdraw. Sakanwertana is Altona Brown. My sister fell in love with her and said, Dawn, we got to invite Altona to come have supper with us. And my sister was a very good cook. And she made this delicious gravy. And so she wanted to make sure that Altona had some of this gravy that, you know, went with the food. Well, she actually bragged. She didn't say, I'm so good like that way, but she said, oh, this gravy turned out really good. You're going to have some. Well, that was over the top. In Altona's way of thinking, that's disrespectful to the animal that gave you that gravy, that you spoke about it too highly. And so she could not have that gravy because my sister crossed the line to disrespect. So just being aware that sometimes people will just withdraw from a communication. And it is okay to use humor. If you want to know more about this, there are resources. And I think I do have another slide after being thankful to all those who shared their stories with me. There is a website that you can go to. Dr. Father Alexa recently passed away, but during his life, he had been married to a Yupik lady from Southwest Alaska and shared a lot of his insights on culture through his work in ministry and through his interactions with his own family, and also would do so humorously. So you may enjoy seeing about that. All right, thank you everybody for letting me come and share stories.
If anybody has any questions, you can direct them to Dawn or one of the business partners, and we'll put you in touch. Thank you so much for attending today's session, and thank you, Dawn,
All right.
so much for your wonderful presentation.